Hi, everyone. Welcome to the Cost of Cuts, the real-world impact of proposed SNAP changes, hosted by the Food Research and Action Center. I'm Steve Hayward, FRAC's Communications Manager. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, select the Show Captions in the bottom taskbar and choose English as the spoken language. We'll have time for questions and answers at the end of the presentation. To ask a question at any time, please use the Q&A tab in the bottom taskbar. With that, I'll pass it off to Gina Platanino, SNAP Deputy Director at FRAC. Take it away, Gina.
Thank you, Steve, and thank all of you who have taken time out of your very busy schedules to talk about more harm that may be coming our way to very vulnerable populations. Next slide, please. Next slide, please. We wanted to start off by really talking about what is this program, right? SNAP is more than a avenue to feed individuals. It delivers assistance quickly and effectively. It responds to the economy. It helped over 42 million low-income individuals. It bolstered local economy. When we're in a recession, it can equal up to $1.80. It improves dietary intake. It lifts millions of people out of poverty. It supports work. It is efficient, and it reaches key vulnerable populations. Next slide, please. Looking at a very small aspect, when you think about your mom and pop grocers, the ones that are in your town, the bodegas and the small grocers, just with them alone, last year they created over 250,000 jobs in community grocery stores and over 139,000 additional jobs in retail and related sectors like agriculture, manufacturing. It created over 20 billion in wages, 2.6 billion in federal taxes. While there's a sales tax associated to SNAP purchases, but SNAP sales generate additional economic activity that brought in over 2.6 billion in federal tax revenue in 2020. And SNAP is also associated with sales and administration at the grocery store level, which contributed to more than 1.9 billion in state and local tax revenue in 2020. Again, in this state and local tax revenue stays locally, which helps fund all of our public services, and depending on the municipalities, many of them depend on this. Next slide, please. So what are we talking about? Some individuals call it SNAP work requirements. We call it time limits because SNAP has historically had work requirements. These work requirements is if you are signed up for SNAP and go through the very lengthy application, in order to remain eligible, you need to register for work, right? You need to participate if you're assigned into an employment and training program or a work fair program. You need to provide information on employment status and availability. You need to report to employers when referred by the state agency. You need to accept a suitable job offers, and you cannot quit or reduce work hours without good cause. So there are already work requirements. We call it time limits because it really is a time limit on what individuals can receive SNAP if they don't meet their time limit requirements. Next slide, please. So if we look at the history of SNAP, there always have been opportunities to protect the program, to strengthen it, and there have been opportunities where legislation through various vehicles has weakened the program. One particular vehicle was in 1996 through the Personal Responsibility Act, where we came up with what we're talking about, the able-bodied adults without dependents. Next slide. This concept that individuals within a certain category originally from who were without dependents, without children, who were 18 to 49, could only get SNAP for 3 months in a 3-year period, unless the individual was working 20 hours a week, was in a qualifying job slot, or made one of the limited exemptions. Next slide. So that was 1996. And when this was signed into law, President Bill Clinton was very clear into saying, I have concerns about other provision of this legislation, right? Specifically, it fails to provide SNAP, that time food stamps, to support ABODs, able-bodied adults with dependents, who cannot find a job, keyword, or are not given the opportunity to participate in a work program. Next slide. The other co-drafter of the Personal Responsibility Act also said, it is only, this was intended to be, it is only if you're able-bodied, if you are childless, and if you live in an area where you are getting food stamps, and there are jobs available, then it applies. We do know that as a whole, that there's a high unemployment rate and many individuals are not in places where jobs are available. Next slide. So where we are, right? So 1996 opened the door to this programmatic change where now individuals were being punished for not being able to show enough hours. This opened the door to 2023 during the Fiscal Responsibility Act, which expanded the time limit from 18 to 49 now to 54. And it did add some exemptions to veterans, unhoused individuals, and youth who had been in foster care. But it also restricted the state's ability for discretionary exemptions, meaning their ability to acknowledge and understand their state and saying how they were going to exempt certain populations or certain counties or certain regions. Next slide. This is very important for us to know. So this is really a cut for individuals. And like on the other program, the states have absolutely no obligation to provide skills training, employment services, or transportation assistance. So all it does is you haven't met the three, you haven't met enough hours, we're going to cut you off. But no one is offering a job. No one is saying, here's the transportation that you need. No one is saying, here are the resources that you need to be able to have that job, right? And so we know that individuals who are being harmed by this are individuals with undiagnosed impairments. It denies food aids to individuals who are actively looking for work, but they're unable to find an employer, and underpaid individuals who cannot show enough hours. It doesn't take into account commuting costs. It doesn't take into account individuals who their own employer will not give them enough hours. Next slide. And now to really talk about the impact as a whole level of what this will have, we have an amazing panel of various speakers who will talk about specific impacts of these proposed rules. These proposed rules, I must add, the proposals right now before Congress is that they want to expand the scope. So the proposal will extend SNAP time limits to adults up to age 65. And also those living with school-aged children, specifically those 7 and up. And it is estimated, the CBO scored, that 3 to 3.5 million fewer participants will be in SNAP each month and will lose food assistance entirely. And that includes possibly over 4 million children who could face reduced household food support. And as I was saying, to really talk about what the impact of this will be, it is my pleasure to introduce Nina Stoller. They are the policy coordinator for the Autistic Self-Advocacy Network, where she provides the portfolio for disability and employment for LGBTQI+ rights, public benefit programs, and community integration. Nina is also learning to write in plain language for ASAN. And before this role, they were a 23 policy fellow with the Autistic Women and Non-Binary Network and a 22 Coelho Disability Law Fellow, during which they wrote a research memo for Bazelon. Nina, thank you so much for being here. I'll turn it over to you.
Hi, everyone. Can you see my screen?
Yes.
Okay, great. As Gina mentioned, my name is Nina Stoller, and I am here to talk about disability access, specifically barriers to SNAP for people with disabilities. I'm going to be answering the question, how would expanded time limits and narrow definitions of workability impact people with disabilities? As Gina mentioned, I work at the Autistic Self-Advocacy Network. We are a national 501c3 dedicated to the issues affecting autistic people and other people with intellectual disabilities. ASAN works to ensure that people with disabilities have equal rights and the support we need to live our best lives, which necessitates our inclusion in the policymaking process. Again, yeah, I'm Nina. I use they, them pronouns as a visual description. I am a white genderqueer person with short brown hair and glasses. I support our policy portfolio for disability employment, LGBTQI rights, public benefit programs, and community integration. I am going to do some level setting real quick before getting into specifically how time limits and requirements hurt people with disabilities. So yeah, the level setting. Poverty. People with disabilities are disproportionately in poverty, and those statistics are even worse for people of color who are disabled. Oh, I am so sorry. I clicked out of The screen. Okay, now I am back. Okay, my slide deck. Sorry about that. I think I clicked a link. So these are the poverty numbers. I want to emphasize that people with disabilities are more likely to live in poverty. And as I said, people with disabilities who are people of color are even more likely to be experience poverty. A similar thing for housing insecurity. 4 in 10 disabled people are struggling to afford their rent, and that statistic is even worse for disabled Black and Hispanic renters. And then economic justice overall, whether it's bills or incarceration or the wage gap or racism more generally, people of color and disabled people of color face these challenges. Disabled people are almost twice as likely to be unable to pay their monthly bills. Nearly half of all incarcerated women have a disability, and disabled workers face significant wage gap, especially Black women. I want to highlight that disabled women workers are paid 50 cents for every dollar paid to a non-disabled man, and Black disabled women are paid 45 cents for every dollar. In terms of food insecurity and tying it into SNAP, amongst low-income U.S. households that include someone with disabilities, approximately 4.2 million are food insecure. And whether or not you have work-limiting disabilities or non-work limiting disabilities, you are more likely to be food insecure, which I said, sorry about that. More statistics saying the same thing, but I just want to highlight that food insecurity is a real problem for people with disabilities. So to emphasize, more people with disabilities would be working if they had enough to eat. In summary, SNAP is vital for people with disabilities. 10% or 1 in 5 of SNAP's not elderly recipients identify as having a disability. So there are at least 4 million SNAP recipients with a disability. Now that I've done some level setting, I am going to get into work requirements and time limits. So time limits hurt people with disabilities, and exemptions are ineffective. For one, defining who is disabled under SNAP is complicated. It's a separate definition than what Social Security uses, and states have flexibility in determining who is or isn't unfit for work. People who reported having disability, who likely should have been exempt from the time limit, lost SNAP at the same rate as people without a disability. And at the end of the day, they don't work. SNAP time limits don't increase employment rates, so they don't even do what they're supposed to do. In terms of work requirements, there's a lot of issues. Proving eligibility is tough, especially true for people with non-apparent disabilities. There's a ton of admin burden and red tape just to have enough medical documentation to prove your disability. And then there's human error and bias. A lot of these state eligibility workers don't have the medical training to sufficiently screen participants for exemptions. And they may not deem someone disabled enough to get an exemption from SNAP work requirements based on caseworker perceptions, stereotypes, etc. And a similar thing to time limits, SNAP work requirements don't increase employment rates. They don't do what they're supposed to be doing. Also, I want to flag work requirements are unpopular across demographics, amongst disabled, non-disabled, across parties. Work requirements are unpopular. Impact. Any cuts to SNAP, I see a work requirement as an effective cut, and I see a time limit as an effective cut. Any cut in SNAP funding will harm children with disabilities. The stakes are high. So if low-income families with children lose their SNAP and or Medicaid benefits, it's going to burden families it's going to be harder to get kids the food they need to be in school, to be healthy, all of those things. In terms of adults, for low-income older adults who are duly eligible for Medicaid and Medicare, SNAP participation is associated with fewer inpatient visits, fewer emergency department visits, fewer long-term care admissions, and lower medical costs. So it's a win-win-win-win-win. Just to wrap it up, I know I'm almost at time. Decreased time limits and increased work requirements will worsen outcomes for SNAP eligible people with disabilities, especially considering the often high costs of medically necessary diets for people with disabilities. If you don't know what I mean by medically necessary diets for people with disabilities, some people's disabilities or health conditions require that they eat or don't eat certain things. I see you coming on time. Okay, I'm wrapping up. I just want to say that SNAP funding, it's not just about outcomes, it's a matter of life and death for disabled people. Thank you for listening.
Thank you, Nina, for sharing, because it's broader than that, right? People assume that there are specific disabilities or what captures that, but there are so many different layers and levels and different needs that are not easily captured. So we appreciate you sharing the statistic of how it really is a matter of life or death for many individuals. Our next speaker will really focus on the rural challenges that we face in some communities. Rachel Miller is the Chief Advocacy Officer from the Food Bank of Alaska, where she leads public policy and advocacy efforts focused on hunger and food security across the state. With roots in sustainable food systems and a background as a Peace Corps volunteer, she's worked in the Alaska Food Policy Council and teaches at the Alaska Pacific University. Thank you, Rachel, for being with us. My question to you is, how are rural communities and high unemployment regions already struggling with current time limits, and what are the consequences of expanding those time limits further?
Thanks, Gina. Thanks everyone for being here. Again, my name is Rachel Miller with Food Bank of Alaska. We're based down here in Anchorage. And in case you've never seen a map of Alaska before, we like to use our hand map. So you all now have a map of Alaska too. So here's our Aleutian chain, here's our southeast, and we're right here, down here near the bottom of the state. We are a significantly rural state. Alaska is a cool place because we are the reason that the United States is a circumpolar nation. We are the reason we have access to an enormous, vast deposit of resources up here. And we also have a significant problem with hunger. So 1 in 8 Alaskans are experiencing hunger. 1 in 10, thank you for the slide. 1 in 10 are on SNAP. And often when, we just got back from the FRAC conference, often when we go to the Hill to legislate, we try to talk about how Alaska is like everyone else, even though we are extremely unique in some areas. So I'll try and make some of those ties together today. But just to set more of the landscape up here, again, 1 in 8 Alaskans experience hunger. It is 1 in 6 kids. For our employment and training options, we are an optional state. We do have an ABOD waiver that covers most of the state. We've had some success in food policy at the state and the federal level. So broad-based categorical eligibility went through in our last state legislative session. So that is on track and supposed to go live July 1 of this year, barring changes to that at the federal level. We are deeply concerned here about the potential changes, all of the proposed changes that have been discussed to the SNAP program. So one of these being some of the most recent headlines that have come out around the proposed cost shift of the administrative costs of SNAP coming to, or the programmatic cost coming to the state. So what did we see? Feeding America just put out, all of you food banks, they've put out state specific information like as of 4 hours ago. And we're seeing that if even 10% of SNAP cost is shifted to the state, that's going to cost us about $25 million. And that's important to think about in terms of scope of our population, right? So our population is about 700,000 total. So all you Californians, I know some of these numbers are laughable, but for us, every dollar really matters. And we do not have sales tax in the state. We do not have income tax. We are really struggling to figure out sustainable long-term revenue streams. So our state budget discussions are very tense. We're struggling to fund education right now. So when I look at this $25 million cost shift, if the state is to assume more cost of the SNAP program, that is in the ballpark of what we've proposed to cover universal school meals, which is something we do not do in Alaska, but trying to put this, unfortunately, this now looks, we're trying to not pit nutritional programs against each other. but we are trying to help legislators understand what is the scope of feeding people in this state. So, so I'll leave that. Okay, I'll leave that there. Proposed cost shifts would be awful for us. We are plagued with chronic backlog issues, both in Medicaid and in SNAP. We have a good relationship with our Division of Public Assistance. We have a good relationship with the director. We regularly meet. They are trying to do more with what they have, and they are making progress on the backlog. But I think similar to what many of you are experiencing is once you get a little bit of forward momentum, you get a little bit of, you can see change on the horizon with invested time and resources to make course corrections. All of these proposed changes right now are coming at what just feels like an impossible perfect storm moment where it would slow the progress already made. We know that the last round, when the House budget came out, the Thrifty Food Plan was not touched in that round or that proposal. But we are concerned that if the Thrifty Food Plan was rolled back, that would put about a 49% gap between what people on SNAP have access to and what a modest meal costs in Alaska. We have high cost of living and we have high cost of food. So the meat of what I'm supposed to talk about today is rural considerations. And we have fewer road miles in this state than Vermont, and we have almost 700,000 square miles to cover. So we have challenges in our rural communities with job availability and job consistency. We are often a highly seasonal state as far as community access, as far as travel. Frozen rivers are still very much a thing when you look at getting from community to community. We're looking at, we have to pay attention to everything from weather station improvements and weather station funding to NOAA ocean buoy funding for sea and air monitoring. And that is how we deliver our food to rural Alaskans. We actually run our own little post office here outside of our warehouse. So the lack of consistent job availability, that pays anything remotely to a livable wage is tough for us. And that's the number one thing we talk about in rural Alaska when it comes to work requirements or timing. We have a very disconnected geography. Boats, planes, trains, sometimes automobiles, but maybe not car automobiles are how we get people around the state. So it's simply just infeasible. It doesn't make sense to require people to have a job in a place where there's not an adequate amount of jobs. We also have significant challenges with rural food perishability. And once food gets to rural Alaska, it is usually on its last leg as far as shelf life. And so we're looking at compounding with, all of these things, work requirements, time limits. We are also, there are two bills right now that are proposing some SNAP food bans, right? A soda ban and a food dye ban within foods to be purchased under SNAP benefits. Coming up on time, the last thing I'll mention is that we have significant communication delays. And so any additional burden placed on the Division of Public Assistance to enforce these work requirements, they're struggling right now. We have a high vacancy rate. And so all of these things are contributing also to communication delays, where folks who are required to now have interviews for SNAP were sometimes getting their letter about the interview in the mail on the same day their interview was scheduled. So that's where we're at. I'll stop there.
Thank you, Rachel, and thank you for just letting us know that you're dealing with just quite a lot, not just with the administrative burdens that are coming, but also what it means to live in Alaska in terms of livable wages. And these are the things that are very important to let our members of Congress know, because every state is different. And the rural reality is that for individuals, we say we care about the rural communities. We need to make sure that they have the resources and the opportunities to be able to have food, and these time limits will make things worse. To keep talking about rural areas and what the regional impact will be, our next speaker is Emily Weicker Bryant, who is the Executive Director of Feeding Indiana's Hungry. She's a seasoned legal and policy professional and has a decade of experience in the Indiana Senate and state government. Emily, from the perspective of state food banks, what do these proposed changes and time limits mean for food insecurity and support infrastructure in the areas with high need and limited capacity?
Thanks, Gina. I know there's got to be a bunch of food bankers on the call, and a lot of them are part of the Feeding America Network, but our 11 member food banks in our state association are part of a network of 200 food banks across the country. And the point that I emphasize repeatedly with anyone that I talk to about SNAP is for every one meal that a Feeding America affiliate food bank distributes, SNAP provides 9. There is no way that we can food bank our way out of the notion of large scale SNAP changes. So in Indiana, we're in an interesting place. We have a lot of moving pieces going on. We have had executive orders that they are in the process of putting into effect, like many other states, on some junk food waivers. There was an executive order that would make us go from optional to mandatory employment and training. Although there's no details on that yet, because quite frankly, I don't think they have them. And some other bits and pieces about how we could crack down on pieces of the SNAP program that we need to do to make people healthier and to make sure that, you know, the people who are getting the benefits are needing them. And we really don't find that to be the case. For what we see at our state level and what we see at Congress, it's important to remember that every time someone's talking about a cost savings, they're talking about missing meals. They're talking about people being hungry. And it's important to put it in that frame. We know that in Indiana, for that cost share piece, for example, that I just sent to one of our member staffers who sits on the ag committee, if they implemented that next year for Indiana, it's $143 million in benefits that the state would have to pick up for the 10% cost share, which is about 53 million meals. For comparison, our members distributed 108 million meals last year. So that's nearly halving the amount of food that our members are distributing that would be lost in SNAP benefits. We have about just under 600,000 Hoosiers that are enrolled in SNAP. And when we look at what those other things would be, the push to different work requirement populations and things like that, I know that our state isn't prepared for any large scale increase in what we do in employment and training. We've adapted to the federal changes that have come down, and we've done so, I think, with a fair amount of skill and communication. But we have less than 1,000 individuals who are currently on our employment and training program through SNAP. And I've reiterated this with both Congress and our state officials. We can't afford to change that. We can't afford to cover the cost share. And we really can't afford the measures that Congress is looking to do and that our state is trying to do at the same time. When we look at state legislatures, ours is done. We do a biennial budget here in Indiana. We wrapped up April 24th, and they won't be coming back for 2 years to look at a budget. The actions that Congress is doing, along with these executive actions we're seeing from our administration, are all happening outside a budgeting process. In a space where we're already being told that there's no money. Indiana cut an additional $2.4 billion out of their state budget at the end of session because of the economic forecast revision that we got. And we've incidentally also withdrawn from Sunbucks in the last couple of weeks, with some murmurs about the cost associated with that would be substantially smaller than the cost share piece. And so looking at what they're trying to do and how the food bank sector and the charitable sector meets that need, we can't fix this problem. This is a policy problem. This is not a food problem. We know that our members are distributing at highest levels. We're already talking about what in our crisis communications plan do we talk about when we run out of food, or when there's no food left in the warehouse, or when we can no longer do some distributions based upon things that we're seeing from changes at the USDA. Honestly, retail and manufacturing are wildly more efficient than they were before the pandemic because they suffered supply chain issues, and consequently we're seeing less product as a result. And then watching my members spend more and more, expecting to spend $18 million this year to purchase food to try to supplement for what we're not seeing coming through those regular streams. So it's what this will look like on states, on food banks, on the rural economy, because we're Midwestern, we're very rural in many ways, is unsustainable, and ultimately means that people will be hungry. And there's really no silver lining to any of that.
Thank you, Emily. There's no silver lining. It is incredibly difficult. There are no jobs popping out of anywhere. Everyone's struggling. And in addition to that, food prices keep increasing, right? And also in places in rural areas, you know it best, people have to drive longer distances, right? So gas prices, transportation, it also adds. So thank you both, Emily and Rachel, for really putting the perspective of what it means to live in rural areas and what those barriers mean in terms of time limits. Our next speaker is going to speak about the proposal to impact adults with children dependents. This is a historic change. You know, since the beginning, since 1996, individuals with dependents were exempted. And to do this will have a terrible impact, which Andrew will talk about. Andrew Chain is the Managing Director of Public Policy at Grace and Child Poverty California. He brings more than a decade of experience in anti-poverty and anti-hunger advocacy. He previously served as the SNAP Deputy Director at FRAC and as a Government Affairs Director at California Association of Food Banks. Andrew, can you tell us what would expanded time limits mean for caregivers, particularly single parents? And how do these proposals misunderstand the realities of caregiving and low-wage work?
Thank you, Gina. Thank you, FRAC, for having me. And it's just an honor to be on with all these great partners. We can go to the next slide, please. So just to really start from this goes, and a lot of you may know this history, but there are excellent pieces by Dr. Elisa Meinhof and others that get into the racist roots of work requirements. But when we're talking about expanding the 3-month time limit to parents and caregivers with dependent children, I think it's just really important to note that the history of our social policy goes back to enslavement, and as does the history of caregiving work in this country. And so this is just a quote from a comment against one of the proposed rules during the first Trump administration that I think helps ground us. And again, there's a deep literature on this. If you're not familiar with this, but I think we really need to understand that particularly women of color have been forced to do the unpaid and unrecognized caregiving work. And as Gina pointed out, the 3-month time limit has always excluded these types of households. And so for the first time in more than 30 years, we're seeing a proposal to include parents and caregivers with children 7 years of age and up, right? Because if you break down what ABOD stands for, able-bodied adults without dependents, it's actually in the title of this policy. So even by the low standards of this policy area, this is truly an odious and historic change. All right, next slide, please. So just even without these changes, my colleagues have covered this, and I think some of our partners at state agencies will cover it even more. But when you start to think about what it looks like for this policy on the ground, we've already heard from colleagues about how disabilities are not recognized, and so many folks are swept up in this policy who shouldn't be, and the costs are just so high in having your food assistance taken away. And even when you have state agencies that are trying to do their best to navigate these, we can see that even helpful areas like individual exemptions, area waivers are extremely challenging to implement. And we saw this in California, where we had a bank, this is a few years ago, and the banks have been taken away, but we still saw folks lose their food assistance. And so just it's a recognition of how impossible this policy is. And there's a lot in Congress that want to talk about error rates and fraud, waste, and abuse. And one of the ways in which we could actually reduce errors in the program is to get rid of not only cruel, but incredibly complicated policies like the 3-month time limit. But instead, we're going to try and expand it potentially to parents with children 7 years and up. So you can imagine how challenging that's going to be to even figure out which households that applies to. All right, next slide, please. But we need to be really clear about what this is that the 3-month time limit, as folks have already said, does not offer a job, does not offer an employment and training opportunity that may be possible in some circumstances. But I think when folks hear work requirement, they think, oh, like everyone's offered a job. No, that's not the case. It's that you need to be able to show compliance with these complicated requirements, or your food is taken away. And now we're talking about taking away food, including families with children. And we know that adults are always looking to protect the children in their households, but that doesn't mean that children don't suffer. When food is taken away from their parents, when parents and caregivers are facing that toxic stress, and that burden is spread out and put on the entire family. And it's just a shameful proposal that we would even be talking about doing that to families with kids. Next slide, please. So when we're looking at exactly how large an impact this would be, 3 million parents and grandparents living with children, right? This is not a small population. This is pop quiz. How many folks are accessing SNAP right now nationwide? About 41 million. So this is a significant population writ large, but it's a huge percentage even of the existing caseload. And one thing to note is that when we say able-bodied adults without dependents, it makes it sound like right now the policy is only applied to folks without children, but that's not true either, right? And that lie is that those folks are not parents when in fact they are parents, but they just don't have custodial kids who are part of their SNAP household, right? Families experiencing poverty are disproportionately subject to the criminal justice system or the child welfare system, and our non-custodial parents, right, are in the process of reunification, and taking away food from them is not helping those family situations either. All right, next slide, please. Now, probably preaching to the choir here, but this is really important, especially for those of us, and I love to hear from my colleagues who are trying to educate folks about exactly how bad this would be, right? And so glad to follow up with folks with more specific information. There's lots of ways to find national and state data, but I think it's pretty obvious in this day and age how prohibitive childcare is. And that's not just for young children, that's for school-age children, right? My kids are 9 and 12. I am absolutely one of the households who is paying a lot of money for before care, for after care, right? For what does it take to really be working, right? To be in compliance with a policy like this, and to make sure that your children are safe. It's an exorbitant amount of money. All right, so we'll keep moving through the slides here, sorry. But I think folks are well aware. We're looking at a huge percentage of folks' income butting up against other non-negotiables like rent. All right, next slide, please. And again, a lot of folks are being, called upon to have multi-generational households because of all of the burdens on parents. There are so many grandparents. And again, the other part of this policy is to be on older adults up to age 65. Next slide, please. And we can skip this one. So just to say, right, here are the choices people are being put into, right? I can't afford childcare, so if I'm going to stay home because I need to keep my child safe to meet their needs, now I might have my food assistance taken away, going against the view of the professionals like social workers about what age it is for children to be home alone safe. Next slide. We can go to the next as well. But I think everyone can agree that this, 7 and up, these are children who are not able to be home alone safe. For all the latchkey kids out there and the Gen Xers, right? I think we know from experience. And I'll just point out that the poorest families are going to suffer the most. We're now talking about huge childcare gaps for TANF families. These are some California data, but the families with the lowest incomes are at least able to afford childcare. All right, next slide. And these families will now be suffering multiple paperwork barriers, right? We're talking about, importing the same kind of failed work requirements that we've had in TANF as a model for the time limit in SNAP and in Medicaid. All right, we can keep going. I know my time is tight. So you've got a lot of partners in this. This is just one example. We're working hand in glove with our county welfare directors. I know we're going to hear from some states here, but there's lots of types of partners from retail to public sector unions to others who can be really helpful, authentic voices on this. And remember that there's legislation bill in Congress to get rid of the time limit altogether. HR 1510 by Barbara Lee was the most recent version. We'll be working quickly to get it reintroduced in the 119th Congress. And I know Gina and others from FRAC will be in touch with ways to support that. Next slide. Okay, so glad to follow up with some resources here and appreciate everyone making space for this conversation. Thanks.
Thank you, Andrew, for putting into perspective what it means, particularly for single parents, the cost that this will have. We've heard a lot about state agencies, and we forget that state agencies are made up of public servants who work incredibly long hours and who are trying to follow what's coming down from the federal pipeline. So next we will hear from Erin Quinn, who's the Acting Assistant Commissioner of Policy and Programs at the Massachusetts Department of Transitional Assistance, where she oversees the SNAP economic assistance and employment programs for families receiving public benefits. She represents Massachusetts and crosses state agency partnerships through the Whole Family Approach JEFS initiative, and focuses on efforts to improve economic mobility for children and families. Her work focuses on evidence-based policy to improve outcomes for low-income families. Erin, what is the administrative and financial burden on state agencies to implement expanded time limits? And how do these mandates undermine support for families?
Hi, Gina. Thank you. And as all of my colleagues have said, we know that SNAP is a crucial safety net for low-income individuals and families in Massachusetts. We provide SNAP benefits to just over 1 million individual recipients. We provide services to 1 in 6 residents across the Commonwealth. But implementing and administering work rules places a very significant burden on state agencies. These challenges stem from the complexity of compliance tracking, the administrative workload, and the financial costs involved. So I thought today we could kind of talk through some of those in further detail. In particular, the able-bodied adults without dependents work requirements have proven to be especially demanding on the states. And one of those primary challenges state agencies face really is monitoring compliance with SNAP work rules. So ABODs must work or participate in an approved training program for at least 80 hours per month, as we had covered earlier, to maintain eligibility beyond the 3 months within their 3-year clock. So monitoring this requirement in real time is very resource intensive and it's prone to errors. For example, state agencies must track the work hours from very diverse and often inconsistent employment records where we're able to verify those. We track training program participation, which can vary widely by region and availability. In Massachusetts, we also have a voluntary SNAP employment and training program. So for reference of the maybe 20,000 individuals that would be looking for a specific activity that would allow them to comply, we have about 1,000 unique opportunities within our SNAP employment and training program right now. Volunteering and community service hours are also very difficult to verify. And a lot of states lack integrated systems that allow us to track these components efficiently. So while some states, including Massachusetts, have made a lot of strides in digitizing reporting processes, the majority, and a significant number of them, still rely on manual data entry and paper forms. What this does is it increases the risk of errors and delays. And as a result, a lot of states often end up with miscalculations on eligibility, things that lead to benefit overpayments or wrongful terminations. And as we know, that just triggers appeals and legal challenges and continues just to mount the continued exacerbated administrative challenge to individuals that are subject to the work rules, as my colleagues have covered earlier. It also increases the administrative workload for us. So the workload associated with implementing work rules really stretches agency resources very thin. Our frontline staff must not only process applications, but they also have to verify compliance every month. So this entails collecting employment records, which, as we said, might be inconsistent or incomplete, conducting interviews to assess eligibility, particularly when those reporting issues arise, managing exemption claims such as disability or caregiving status, which can change very frequently, as we've said. And the pressure to keep up with the federal regulations as they're changing also means that our staff must regularly undergo training on evolving policies, and that also adds to the workload. So this administrative complexity can really delay processing times. It can increase the amount and the likelihood of administrative errors, which, as we know, for a program that is such a crucial program in providing food security, that to have additional processing delays is really just not something that as a state agency we strive to accept when we're looking at the ways that we can increase access to individuals to critical services that they need. There's also the financial cost of implementation, and that financial burden on states can be substantial. So states must invest in upgrading their data management systems to ensure real-time compliance tracking. As we've mentioned, the staffing needs, so the hiring and training of additional caseworkers to be able to manage this increased caseload and reporting requirement. And there's also the cost of implementing technology solutions like online portals and mobile apps to the access question. That really requires ongoing maintenance and updates. So while many states also face increased costs related to audits and compliance reviews. So as we know, the federal government regularly assesses state performance, and failure for us to adequately enforce work rules can result in financial penalties as well. So to avoid these, we really need to invest in our quality assurance programs, which again is just further straining our budgets. So we have touched upon some of the challenges in rural and high unemployment areas, so I'd like to touch upon that as well. So for states with large rural populations or regions of high unemployment, the burden here is even greater. So work opportunities and qualifying training programs, as we said, are often very scarce, and that makes it harder for SNAP recipients to meet the requirements. So that means states are really left with 2 options. We can apply for waivers, which involves very detailed data collection, very complicated analysis to be able to prove insufficient job availability, or we can look to develop alternative work programs. And that requires a significant lift in terms of our partnerships with local agencies and nonprofits. So both of these approaches are really time consuming and costly. And even when they're successful, they're often temporary. And as federal guidelines change, we're constantly looking to reassess eligibility either through further administrative effort or additional cost. So all of this to say, I know we're wrapping up on 1 minute here, is that the implementation and administration of SNAP work rules really presents substantial administrative and financial challenges for us as state agencies. So for tracking to managing appeals and maintaining supportive services, the burden can really overwhelm state system and lead to gaps in service delivery. And we really need flexible federal guidelines, better funding for compliance infrastructure, and targeted support programs that address the root cause of unemployment and underemployment. And without these improvements, I think the goal of promoting economic mobility through work rules will just continue to clash with the reality of limited resources and economic instability.
Thank you, Erin, for providing such a realistic, tangible way that this will impact. And when we think about, again, our public servants, it means that's opportunities to innovate because they have to shift. And Erin can tell you better than that, because innovation is important, but they can't get to it if they have to constantly figure out how to implement these new requirements. And last but not least, we'll hear from Larry Brash, who's the Deputy Division Director at the New Jersey Division of Family Development, where not only is he a licensed clinical social worker, but he works as a Deputy Director for the Division of Family Development, which is responsible for food and economic assistance program. You're in a different region, Larry. And you've done this for quite a while. When the federal government enacts policy changes like time limits, what does that look like on the ground? And I know Erin touched upon a little bit, right? But how does that strain your staffing systems, operations, and what are the consequences and the ability for you to serve families effectively? We've heard across the board, Alaska was just talking about timeliness issues, people being able to get their SNAP benefits on time. We talk about other concerns that other states may have. And if you can also finish with, when states lose the ability to use waivers to exempt high unemployment regions from time limits, what does that mean for struggling communities and your overall program flexibility?
Oh, that was a big question.
Because
but
you're the
good
last one,
afternoon.
Larry, so you're going to finish us off with a bang.
You put me up against the clock so that I can't go over. So thank you, Gina. Thank you, Frack. Thank you, everybody, for joining in. Those are fabulous questions, and probably not often do we really get a chance to talk to everybody out there about the sort of the mechanics that happen behind it. So, it is a federal program. The policies do change from time to time. So what I'd like to do is maybe sort of break it up into two things, if I can, real quick. And one is about the federal changes, and then about that. So from federal changes, anytime there's a change, I'm really kind of concerned about, 3 or 4 things, right? So it's about the people, which of course everybody here is concerned about the people, but operationally think about it as a way of, okay, it's difficult for us to message this, right? I've been in this program for over 25 years now. In case you didn't know, it's not called food stamps anymore, and hasn't been for, almost 20 years at this point, right? But we still call it food stamps because what we learn gets embedded into us, right? So messaging is a very, very challenging thing for a state when things change. We have to figure out how to message that in simple words, right? Congress uses their words, the regulations use their words, and we often have, acronyms and things that we like, but trying to get that into a message concisely for someone to understand, right? So is it specific to this, topic as it relates to ABODs, right? We did just change the time limit parameters with the ages and the exemptions. That required us to make a lot of changes and a lot of new messaging to implement some things for folks who weren't there before. That will happen again, right? And year over year. So getting that consistent message out there in a way that individuals can understand it, as well as sort of pulling back the old messaging for old policy when that happens. All of that comes at a cost. Sometimes to make sure that the message gets out there, it's using media, it's print, it's radio, it's social media in a lot of capacities. We also want to translate all of those things and have a regulatory obligation to translate into those most needed languages. So there comes a cost with all of that. And it's not just a cost of translating, or it's not as simple as, let me rewrite this one-page notice to sort of explain the new time limit parameters for these individuals. What we're really talking about is trying to build that in a way that we can also train all of our county staff. We are a county administered state, so top to bottom, trying to explain all of those notices, train all of those on the processes. But sorry, what I was saying is, with that notice, it's not as simple as a one-page notice. We then need to code that into our eligibility systems who will generate those electronic notices. Those are important for us to maintain for audits. As some of my colleagues have said, we need to be able to prove that what we're doing is the correct thing based on the policy for the individuals that we're serving. So that includes digital records of those things. Our county workers and all of our state workers across. So from anybody, I will tell you, change management is probably one of the biggest challenges that any administrator will have, doing anything, regardless of what the subject is. And so us being able to train and retrain all of those eligibility workers that we have out in the counties. So that becomes a real sort of struggle, right? And like I said, with the reversion back to food stamps, individuals will continue to do that just because it's rote memory. Not just our eligibility workers, but I will say we also have outreach workers out there. Some of you on the call may be part of our outreach teams right here in New Jersey. And if you are, thank you for everything that you are doing out there. But just think about that. It becomes that changing message of, well, if you were on the program before X date, this might apply. After X date, this happens. The system changes can't be understated. And I know we live in a tech world where everything is sort of at our fingertips and everything is doable. So I will say that most things are, but we are dealing, at least in New Jersey, with a very old eligibility system. And many of my colleagues are the same across the state. If you've upgraded your eligibility system, often it is shared. It is not a SNAP only system. So whenever there is a change, all of that needs to be coded to make sure that the system is producing the correct determination. The idea being we need to take that sort of and make sure that those cases are correct. Aaron alluded to it earlier. We have quality control. And if quality control samples a case and finds a variation between what we have in the system and what the circumstances truly are, then we will get a payment error for that. Too many payment error rates, and the state is on the hook for liabilities. So system changes are huge, and most individuals, most states do not have a standalone SNAP system. It is a system that will service, say, like TANF and Medicaid, maybe LIHEAP, maybe any of the other state-sponsored programs that those states have. So what becomes really sort of a challenge is that plan for resources. If something is happening today, well, what we all know is that Medicaid is also looking at potential changes. And so it's all about resources from state to state, who has the resources and the time to make those changes. All of which I will say sort of tongue in cheek here, but oftentimes legislation comes with an effective immediately date. And I think it's safe to say here that nothing happens effective immediately, right? So it's those times and work that we have to do to change those systems, to get those in, to adequately test them. And then I will say for every sort of change like that, and this particular change is very, very complicated to track. It's 3 months within a 3-year period. There's a reinstatement process that we haven't even talked about. If you were disqualified, you can get back on, but prove that. And so now just think about logistically how you track that within sort of a system. I think I'm running out of time, so I'm going to try to hurry through some of those. The waived areas and the potential loss of, some of those waived areas. I mean, if you just think about what that means, right? Currently, waived areas are as such because of their economic conditions, we'll say, right? Unemployment numbers, those sorts of things. So you take a situation where there's the effect on the community is, to lower the already economic struggles that area is having, right? Whether that's by county or whether that's a city, there's already an economic indicator there indicating a struggle. The individual has a struggle. We know quite plain and clear that SNAP benefits are spent locally. They are spent almost in their entirety in the given month, right? So, and carry, a multiplying effect from an economic perspective. So every dollar lost as a result of the loss of the ability to waive some of those areas, and Gina's coming back on, which means my time's running out, but I just wanted to sort of end with that, right? An economically struggling area without the ability to waive is going to face further economic struggles just because of the lack of those. You overlay labor and sort of food and retail sort of job deserts all kind of overlap. And if those SNAP dollars aren't being spent in there, it's sort of undercutting that. So I will close on that and hang around and wait for some questions. So thank you all just again for everybody doing this.
Thank you, Larry. And I'll invite the panelists to come back on video. We literally have time for one question. Thank you all. And, Larry, you bring a really good point because you have a lot of advocates in this room, right? And advocates sometimes get frustrated with state agencies and things not happening without understanding that it's state agencies having to implement what's happening at the federal level. And it differs across the world, but it's across the state and sort of services. But thank you for that reminder of how important this is and waivers. We do have one question here. I think it's relevant. We keep talking, something that keeps one of the excuses for cost shifting, right? I know we're talking about time limits and looking at this is because of these errors that you mentioned, Larry. Can you tell us about what the audit means, or that's not the right term but what do these quality control errors really mean for a state?
Sure. Quality control, if you don't know, is a summary. So every state each month pulls a random sample of active cases and those who were denied or terminated, those cases closed, those sorts of things. Those ones where we're looking at active cases, there's a huge, so if my case was approved in January, quality control might pull the case now for May. Quality control is reviewing the conditions that exist for the month of May only. And even though the client might not have had a reporting requirement or anything like that, if there is a variance above the stated thresholds, that does have to get reported. Those all get summed up and states are then ranked against each other as to who has the highest and the lowest error rates in the country. There are other reviews that we have to go through, on a consistent basis. Every year we get, management evaluations of different parts of the program, whether that's program integrity or program access. And fair hearings is another one, and I feel like I should kick in on Aaron's sort of comment about that. The loss of benefits triggers a right to an appeal. That appeal, we still have due process in the country, right? So that entitles one to those sorts of hearings, and then they may or may not be back on the program, which just, it results in a significant churn, both workload to the person at the county, the agencies that have to do that, as well as the workload of that person just getting back onto benefits to prove their case, maybe to prove the disability that wasn't obvious to the agency worker at first. And I don't know if I answered your question, but this is why you guys put me at the end with a hard stop.
You did. Complicated, complex. SNAP is one of the most regulated, strict programs, very few errors. If we want to talk about fraud, skimming, right? Criminals are stealing people's benefits. That is the fraud that we should be talking about. Individuals who go to the grocery store 100%. And there goes their whole for grocery and there is no reimbursement mechanism, right? That is the fraud that we really need to talk about. We're at time. Thank you all for joining us. The whole point of these cuts would be terrible, but we can do something about it. That's not the first time that this has happened. These threats have happened, and it is better to stop things. Prevention is better than trying to claw back. As we saw, 1996 opened the door, 2023 increased the door. if something happens right now, just the whole roof will be open, and we're just going to keep going at it until more individuals will have to adhere to these time limits. We will be having another webinar this Wednesday by fiscal experts, mayors, controllers from states, talking about the cost of cuts at a municipal level. So we invite you to join us then. Thank you to all of our panelists, and thank you all of you for attending. You have been very informative. And again, say no to cuts. That is the overlong messaging. Thank you all.